Okay, hello.
Well, hello there, Sarah.
All you Chinjin viewers with our new
Setup.
fancy setup.
Thanks to Liz L.
From Oregon, Anyways, we look much fancier in here, so I appreciate it. Hopefully you guys can hear us as soon as somebody jumps on here and lets us know. Sound good? We are discussing today
Muffins! Yay! Everyone's favorite. Yay.
Oh yeah, they're super fun.
Mm.
Yeah, but more than anything, we're discussing the abnormal pap. Yeah, bummer. Not a bummer.
Yeah.
Okay, you ready? We're gonna dive in, guys.
Go.
Nicole tells us she can hear us. Fantastic.
Nicole!
Tell us if we're too loud. Just me. Okay, so when a patient comes in and has an abnormal pap smear, and we tell them, oh, there's some abnormal cells on your cervix. What does that mean?
First of all, which a lot of people think of it, it's you're not dying, okay? Most people have this thing like, oh crap, I don't know, pap smear, I'm dying. But thankfully, most of the times when the pap smear is abnormal, it's not because you're dying, it's just abnormal. We need to work it up and make sure that we know exactly what's going on, and we'll go ahead and try to fix it. So
when a patient has an abnormal pap smear, does it always mean that they'll get cancer? Not necessarily that they have cancer, that they'll get cancer.
That's a tricky question. By far and away, theoretically, if you kind of let it, go for an infinite amount of time, yes, you'll develop cancer eventually. But the thing is that we can prevent any abnormal cells going to cancer. So actually, we can eliminate cervical cancer if everyone had normal screenings at appropriate times. So
got their screenings done.
Yeah, when they're supposed to get it done. Yeah.
Does having an abnormal pap smear with abnormal cells, and I apologize, I'm looking down, we have questions. Does having abnormal cells on a pap smear change how often somebody needs a pap smear?
Yes.
I know that's kind of a broad question.
More, if there is an abnormal pap smear, usually we do more frequent pap smears. The usual protocol is if you do a pap smear, it's every 3 years. However, if you do the co-testing with the HPV screen and you're over age 30, then we can do the pap smear every 5 years. But with abnormal pap smears, we really want to make sure that we're on top of it. And basically, in combination with something called colposcopy, which is a more intensive examination of the cervix, we do pap smears like every 6 months. So
if it's an abnormal one.
If it's abnormal, yeah.
So when it comes to an abnormal pap smear, there's abnormal cells, for one, and sometimes there's another little component that will go along with those abnormal cells. When a patient maybe tests positive for...
What you talking about, Willis?
HPV.
Oh, yeah. What are you talking about? Component?
That other little...
Oh, their test, that HPV.
The HPV, if they have positive, and I know, again, very broad, but when a patient does test positive for HPV, we have somebody asking, what is HPV?
Oh, okay. So HPV stands for human papillomavirus, and it's a virus that gets transmitted sexually with sexual contact. So anytime you rub your sexual parts, your genitalia on someone else, you can get it. So it's really hard to prevent transmission because, like, for instance, if one uses condoms, you can't prevent those areas touching to each other. Those viruses, you don't really know which viruses you're going to get. So it's totally random, actually, as to which ones you get. But it's been shown that this virus can cause some problems. It can cause genital warts, and it can also be the cause of most cervical cancers. But the research shows that this virus you can think of it somewhat like a cold virus, where you get the infection, but then your body, the immune system, actually gets rid of it. So usually, if you have the virus, if your body's going to get rid of it, it gets rid of it within 2 to 3 years. So
In its entirety?
as far as we understand.
Okay. So that was kind of the next question. That was, can I get rid of it
hmm
if you test positive for HPV?
I got you.
You are a step ahead of the game here.
Yeah.
When somebody tests positive, I don't know if that's the right way to say it, test positive for HPV. When a patient has a positive HPV
Mhm.
result,
Mhm.
is that something like another STD? Should they tell that to their partner? Should they let them know, hey, this just happened?
Yeah. Excuse me. It's not a bad thing to tell your partner, to be honest, about your medical history. Clinically, for males, there's not a lot of significance, with exception if he starts having intercourse with other people, because you can the HPV virus does those great mucosal areas. So like the rectal mucosa is a good place for the HPV vaccine to the HPV virus, excuse me, to hang out in. Also, oops, sorry, hit the tape. And also the esophagus, you can get the HPV virus too. So it can be spread with oral sex. So suffice to say, I think it's probably a good idea, to kind of tell your partner what's going on. But usually it's not a problem for the gentlemen. It's just they're mostly carriers.
Yeah. And okay, yeah. Should I stop having sex?
You, Sarah? Wow, we should take this conversation offline, Sarah. Sorry about that.
If I need like a pause button. If I have an abnormal pap smear and I test positive, or I'm positive for HPV, hypothetically speaking, should I stop having sex?
No, we should keep on having sex. But remember, kids, no means no.
I have to word this now correctly because I don't want this to come across wrong. Does that mean that I'm dirty when somebody, I know there's a stereotypical stigma around STDs in general, and you're saying, oh, she's dirty, he's dirty. Does having HPV mean I'm dirty?
No, it's
or any STD.
Again, with the analogy with the flu vaccine, is no, you just happen to get it.
Yeah.
Doesn't mean you're dirty per se. It's just something you have, and yeah.
Okay. So not me.
Yeah.
Does that mean I have an STD if I have HPV?
Technically, yeah. Because if this virus is transmitted sexually, then yeah, it is an STD.
Is it a curable STD?
Yes. So your immune system, if it's strong enough, can get rid of it. So things that can compromise the immune system are things like endocrine problems such as diabetes, if your thyroid isn't working, pregnancy, HIV, if someone's on steroids for, say, a lung condition, those things can absolutely affect the immune system. So if your immune system's good enough and you kind of maximize it, you optimize it by having good sleep, you're eating really well, you're exercising, all things that mom told you, then yeah, chances are you're going to get rid of that virus. But the main thing is to really just get your immune system as optimized as possible.
She's done it again, folks. She jumped ahead and she predicted what my next question was going to be.
Oh.
What can we do as a human to help eliminate HPV? She did it again. Because I test positive for HPV, does that mean that I'm going to get genital warts?
No. So there's several subtypes of this virus, and they kind of separated into what's called a low risk type, which cause genital warts. 6 and 11 usually cause genital warts. And the high risk types, which are 16, 18, 31, 35, 33, it keeps on going.
8, 6, 7, 5, 3, 9.
So no, basically,
Sorry if anyone saw that.
any just because you have the HPV virus doesn't mean that you're going to get genital warts.
When I say sorry if anybody saw that, I didn't mean our duet there. I meant there was a pop-up on the screen. So if that
that would show up?
The pop, I don't know. So if it did,
okay.
sorry. So back to the abnormal PAP side of things.
Mm-hmm.
If I have an abnormal PAP, does that mean that my partner has been unfaithful?
No, not necessarily. Because although you test positive for a virus, that test doesn't really tell you from whom you got it from and when you got it. All we really know is you have it. So no.
You mentioned with oral sex and HPV.
Mm-hmm.
Can you get HPV from kissing somebody who, with just kissing?
Yeah.
Without intercourse.
Oh, without. Oh,
well, maybe the person previously with.
Oh, I mean, just kissing?
Yeah.
I guess I think it would be a very low risk of getting it. But if one had oral sex with a phallus that had HPV on it,
mm-hmm.
I suppose it could, and because it likes the mucosa in the esophagus, but I think that would be very rare.
Okay.
Yeah.
Kind of just.
Yeah, I don't. I'm not aware. I'm not aware of any studies showing that. But I don't really think that.
Not really.
That would
thing.
Really. Yeah.
Okay. If I have an abnormal PAP, does that automatically mean that I have cancer?
Oh, frick no.
Okay, so we didn't cover that one yet.
Well, kind of in the first question.
Yeah. Okay.
Yeah, but no, you don't. Yeah, no.
For those who are just joining us, does it mean I have cancer?
No.
If I have an abnormal Pap smear, does that mean that I can't ever have kids?
No, absolutely not. What? No. You can have kids.
Would there any part of having an abnormal Pap smear potentially cause me to, at some point, not to be able to have kids?
Okay. I see where you're going. Sorry.
No.
The quick answer is no. However, if and it's very rare to have an advanced cancer, but we'll talk about it in a future podcast. We're actually this Facebook Live. Sorry.
Same. We have a microphone,
yeah,
so
yeah, definitely. So it can have some effects depending on what the Pap smear result is and what the pathology shows. It may affect pregnancies in the future. For instance, if you have a more in-depth biopsies, such as a LEEP procedure, which stands for lupus electrosurgical excision procedure, or a cold knife cone procedure. Those two procedures can increase the risk of spontaneous abortion as well as for preterm labor, which can lead to preterm delivery. So there are some ramifications of having abnormal Pap smears, but thankfully, with our patient population, that happens extremely rarely.
Yeah, and I hear this a lot from patients when I ask them, "Have you ever had an abnormal Pap smear?"
Mm-hmm.
And they'll say, "Yeah, at one point I did, but the provider said it was because I was on my period, or the provider said it was because I had just had a baby," or I kind of hear an array of different things that cause patients to have an abnormal Pap smear.
Mm-hmm.
Is there anything outside of like the cells on your cervix being abnormal or the positive HPV that can cause an abnormal pap smear?
I would suppose if you have some sort of vaginal infection or some sort of endometritis, excuse me, it may affect the pap smear to maybe become what's called an ascus, which is an atypical squamous cell of undetermined significance. Such a long expialidocious. Yeah, I suppose that could account for some of the like ascus pap smears, but probably wouldn't explain some of the more challenging advanced pap smears.
So there's not just one type of abnormal pap smear.
Correct. So there are different types of pap smears. One is the most benign one is called ascus pap smear, and if you were to kind of sorry,
Backwards.
Wrong way. So if this is completely normal and this is cancer, so you first have an ascus pap smear, which stands for atypical squamous cell of undetermined significance, where it's not quite abnormal but not quite normal. And then the more I don't want to say the more advanced abnormal pap smear is the low-grade squamous intraepithelial lesion. And then you have the high-grade squamous intraepithelial lesion. And then basically cancer after that. So those are kind of like the different varieties for the squamous pap smears.
Oh no! So we'll be at the Skagit wedding show on Sunday.
So we're having
What's the
technical difficulties.
Point of that being up there. We were going to cover that later, but okay. Anyways, Shireen here asks, I had glandular changes. How is that different to squamous changes, and is it more serious?
Okay.
Good
question. So that's a different kind of abnormal pap smear, and it tends to be a little bit more concerning. So there's two types of cells on the cervix: the squamous cells, and the which are kind of like the outside of the cervix, and then you have the glandular cells, which are inside cervix, which is kind of like a tube. Basically, we're a little bit more cautious with the glandular ones because sometimes they can turn out to be a little more aggressive than the squamous varieties. So for those abnormal pap smears, we tend to do something called the ECC, which means an endocervical curettage, where we get a biopsy of the glandular cells, which are inside the tube of the cervix.
That's a really good question.
Mm-hmm.
Sometimes I learn a lot during these Facebook lives that I've never talked about before.
Learn more about your sex life.
Oh my god! I know. Please pause for this brief interruption. I know sometimes, and I know we've talked about this before on a Facebook Live, but I know sometimes when, like, we'll call a patient and let them know that there was an insufficient sample, and some patients kind of panic and think that means that it was an abnormal pap.
Mm-hmm.
It's not an abnormal pap.
No, it's just
I can't even tell you if it was an abnormal.
Yeah.
pap.
Well, sometimes when we do pap smears, either like particularly in a patient who's postmenopausal, when they don't have a lot of estrogen, their cervix is really thin, and and the cervix tends to be a little bit drier too. So it's a little bit harder to get a satisfactory specimen when you use those collection instruments to get the sample. So it's not worrisome. It's just unfortunately we didn't get enough specimen on the pap smear to let the pathologist get a good read. So
it's not abnormal.
No, not abnormal.
It actually doesn't.
No, just we get to
mean
see you
anything.
again.
Yeah.
Yay!
You get the joys of putting your feet back in the stirrups. Okay. When it comes to an abnormal pap smear,
Mhm.
and you were talking about the different levels, the ascus,
Low grade, high grade,
cancer.
Yeah.
Does it always follow, like, I'm trying to think of the right way to word this. If you got tested in a year
Mm-hmm.
and it was ascus,
Mm-hmm.
or if it, hypothetically speaking, was ascus and you didn't get tested for a few years,
Mm-hmm.
does it always follow like the first it's ascus, first it's low grade, then it's high grade, and just advances through, or can it like?
Well, it does advance through. But the good news about cervical cancer is usually it takes 10 years to develop. So when we see you folks, hopefully we get it in a place where it hasn't, developed. And that's usually the case. So pap smears you should get definitely at least every 1 to 3 years.
So if somebody has their pap smear and maybe they've never had an abnormal pap smear, and then they get their pap smear and it comes back as high grade. Does that mean there's no hope? There's no cure?
Oh no!
Too far advanced.
No.
Can't do anything about
we
it.
have to definitely give it a workup, because sometimes when you have an abnormal pap smear, it's coming from like one spot, one island of abnormal cells in the cervix, and if we do a cold knife cone or a LEEP procedure, we can theoretically get rid of it. So no, all hope is not lost. Definitely. We just need to work it up and actually find out what's going on. So
awesome. Is there ever a time where somebody can have a very abnormal pap smear like that and not do anything about it, and then come back and have a normal pap smear?
I suppose that could happen, particularly. Actually, actually that does happen. That's why some of the younger population, we haven't started pap smears in like the teenagers. In the past, we started pap smears at either age 18 or the onset of when having sex. But we found out that that population, their immune system is so good that, say, if they got a high grade pap, their immune system is actually really, really good and would get rid of it. And then unfortunately, the medical community at that time didn't have enough information. So we used to do a lot of unnecessary colposcopies and other cervical biopsies. But in those populations, in the teens and people in their early 20s, their immune system is so good that it actually gets rid of it. So that's why we've been less aggressive on people in their teenager years and their 20s with respect to pap smears. When
you were talking about when a patient has positive HPV, ways for their immune system to help eliminate it. Can those same things help be preventative towards HPV?
Oh, yeah, absolutely. Absolutely. But the best thing currently is to get the Gardasil 9, which is a vaccine that prevents 9 of the subtypes of the HPV. So it'll help prevent basically cervical cancer, most cervical cancers, as well as genital warts, and it can prevent like anal cancer and esophageal cancer. So I think that's
because of that virus.
Yeah, because of that virus and the cells that it likes to attack. So yeah,
that's interesting.
It'd be so great if this world were without, cervical cancer, like esophageal and anal cancer,
and all the other. So that Gardasil 9,
Nueve,
yes. Mien? No, is that wrong?
What language are you speaking?
I don't know.
Oh,
I don't know. Ask what? How do you say it in French?
Neuf.
9. Where could one go to get that Gardasil 9?
Well, you can get it here at Chihuahua. Yeah,
how about that?
Yeah, and I think you can probably give people vaccines too. Sarah.
I think I can. I've been told I'm relatively okay at it. I don't leave too much of a bruise. No, I'm just kidding. I'm the best.
I know you are.
I'm the best. So is there anything else that you feel we should share with our lovely viewers here?
Oh, there is a Skagit wedding show.
Oh, weird. We hadn't mentioned it yet.
Yeah, that's going on this weekend. We love to see you there. We're gonna kind of show our hydrofacial machine, which does an amazing job of cleaning your skin. So it's not really like a facial, like you would imagine not like rubbing your skin and massaging it. It's actually getting out all the crap in your pores and just amazing.
It does a really good job.
Yeah.
It's called Hydra Treatment.
Yes.
We will be there. So if you're getting married, if you know anybody who's getting married, if your daughter's getting married, if you have a son-in-law that you're trying to push to pop the question, I don't know, a daughter trying to put, I don't know, anybody, come down, because we actually have some really great specials that will be
Promoting.
Thank you. I was going to say purchasing. Promoting at this beautiful wedding show at Tulip Town in Mount Vernon. Tickets online are $8, $10 at the door. So come and see us, because it's supposed to be really fun. And there's raffles. Lots of raffles.
Oh, there are?
Yes.
Oh, okay, cool. I don't know.
You'll get to see us, which is really the most important part.
Exactly.
So, if anybody has any questions about abnormal pap smears, about HPV, about pap smears in general, about,
Come see us, make an appointment.
call us, DM us,
Yeah.
message.
And next week we'll have Miss Morgan here. Same bat time, same bat channel.
and talking about, I'm not sure yet.
Yeah, I don't know.
She
She'll
knows.
figure something
She knows.
out. Yeah.
She's got it planned. All right, guys. Thanks so much. Have a great weekend. Enjoy this weather. Hopefully nobody gets snowed in. And we'll see you
See you
next
then.
week.
All right. Bye.
Toodles.